So good day guys, today I'm going to perform ECG or electrocardiogram test. So first, gather all the materials such as cotton balls with alcohol, ECG machine, and clean gloves. So clean gloves. Then next, checks the physician's order. Okay. Then confirms the client identification, compares the name with the name on the ID bracelet of the patient. So, sir, ask ko lang po kung ano pong pangalan po nila. And kailan po yung birthday po nila. Okay, check ko lang po. Okay, tama naman po. Then, provide privacy and explain the procedure to the patient. So, good evening po, sir. My name is Chrissy, your student nurse today. So, today po is mag-run po tayo ng test for ECG or electrocardiogram test to help me diagnose any heart complications and the heart rate of your heart po. And then, if meron po tayong possibility na magkaroon po tayo ng heart attack. And then, wash his hands and don gloves. So, as you set up the machine to record a 12-lead ECG, explain the procedure to the patient, tell the patient that the test records the heart's electrical activity, and it may be repeated at certain intervals. Emphasize that no electrical current will enter his or her body, and tell the patient the test typically takes about 5 minutes, and ask the patient about allergies to adhesive as appropriate. So, sir, explain ko lang po ulit na magte-test po tayo ng electrocardiogram to know the electrical heart activity po. And don't worry po na wala pong kayo ma-feel or makakapasok ng kuryente sa katawan niyo po. And then, magtatagal po ito ng 5 minutes lang po, sir. So, mag-relax lang po kayo. Ask ko lang po if meron po tayong allergy po sa adhesive. So, wala naman po. Then, next, place the ECG machine close to the patient's bed and plug the power cord into the wall outlet. So, okay, place ko na po. And if the bed is adjustable, raise it to a comfortable working height, usually elbow height of the caregiver. Okay, adjust ko lang po yung bed niyo, sir. Have the patient lie in semi-Fowler's position in the center of the bed with the arms at the sides. Raise the head of the bed if necessary to promote comfort. Expose the patient's arms and legs and drape appropriately, and encourage the patient to relax the arms and legs. So, sir, i-position ko lang po in semi-Fowler's. Comfortable naman po kayo, sir. Select flat, fleshy areas on which to place the electrodes. Avoid muscular and bony areas. If an area is excessively hairy, clip the hair. Do not shave the hair. Clean excess oil or other substances from the skin with soap and water and dry it completely. So, i-clean ko lang po yung chest niya, sir. Apply the limb electrodes. The tip of each lead wire is lettered and color-coded for easy identification. The white or RA lead goes to the right arm. The green or RL lead goes to the right leg. The red or the LL lead goes to the left leg. And the last one is the black or LA lead goes to the left arm. Peel the contact paper of the self-sticking disposable electrode and apply directly to the prepared site as recommended by the manufacturer. Position disposable electrode on the legs with the lead connection pointing superiorly. Then next is connect the limb lead wires to the electrodes and make sure that the metal parts of the electrodes are clean and bright. Expose the patient chest, apply the precordial lead electrodes. The tip of each lead wire is lettered and color-coded for easy identification. The brown or V1 or to V6 leads are applied to the chest. Peel the contact paper of the self-sticking disposable electrode and apply directly to the prepared site as recommended by the manufacturer. Okay, position the chest electrodes as follows. V1, fourth intercostal space or right sternal border. Okay, so V1 po. V2, fourth intercostal space at left sternal border. V3, halfway between V2 and V4. And then V4, fifth intercostal space at the left mid-clavicular line. V5, fifth intercostal space at anterior axillary line, halfway between V4 and V6. And then V6, fifth intercostal space at mid-axillary line level with B4. And then connect the precordial lead wires to the electrodes. Make sure that the metal parts of the electrodes are clean and good. After the application of the LEDs, make sure the paper elector is set to the standard 25 amp per second and that the machine is set to full voltage. Ask the patient to relax and breathe normally and instruct the patient to lie still and not to talk while he record the ECG. So, sir, relax lang po kayo and breathe normally. Then, iwasan po natin na makipag-usap po para tuloy-tuloy lang po yung ECG natin. Press the auto button. Observe the tracing quality. The machine will record all 12 LEDs automatically, recording 3 consecutive LEDs simultaneously. Some machines have a display screen so you can preview waveforms before the machine records them on paper. When the machine finishes recording the 12 LED ECG, remove the electrodes and clean the patient's skin, if necessary, with adhesive remover for sticky residue. After disconnecting the LED wires from the electrodes, dispose of the electrodes. Okay. And then maintain proper body mechanics throughout the procedure. Throughout the performance of the procedure, show calmness and confidence while performing the procedure, show neatness throughout the procedure, and demonstrate spontaneity during the procedure. So, sir, okay, tapos na po tayo mag-ECG. Alisin ko lang po. Thank you po.